our today's topic is like the basics of the laparoscopy. Now, obviously, you have to understand what is laparoscopy. So, it is a minimal access procedure that is basically allowing endoscopic access into the peritoneal cavity. So, in the last session, we have discussed regarding the various ways of the minimal invasive technique. But in this case, laparoscopy, we are getting the access into the peritoneal cavity. And this is basically done after the insufflation of the gas to create a space between the anterior abdominal wall and the viscera. Okay, and this space is basically helping us to manipulate the instrument as well as the organ. So this space is basically creating through the creation of the pneumoperitoneum. Means we are basically insufflating the gas inside the abdomen. Okay, so this is basically associated with like there is a creation of the space, and that space is itself help us to manipulate or to deal with the viscera and the instrument and the organs. Now, obviously, there are intraperitoneal, extraperitoneal, abdominal wall retraction, which is also known as the gasless laparoscopy, or sometimes hand-assisted, means which is known as the Hassen's techniques are also there. Like in the intraperitoneal, extraperitoneal. So extraperitoneal is your total extraperitoneal preperitoneal repair of the hernia. So which is also known as the tape procedure. Okay. So in that case, we just mostly try to remain on the extraperitoneal, like just above the peritoneum.
Laparoscopic surgery, also known as keyhole surgery, is a minimally invasive technique where surgeons operate through small incisions using a thin, lighted tube called a laparoscope. This camera-equipped instrument allows them to see inside the abdomen or pelvis without making large cuts. Laparoscopic procedures such as gallbladder removal, appendectomy or hernia repair offer patients smaller scars, less pain, faster recovery, and shorter hospital stays compared to traditional open.
Telescope, okay? So there are three important structural differences in the telescope. So in the image that has been given above, these are all the like the posterior portion of the telescope, and this posterior portion of the telescope you can able to see that there is a jack, right? So this jack is basically insulating with the light source, right? So from that source there is a we are about to get the light from that source only, and now your 6 to 18 rod lens system telescopes are available, and your telescope is like nowadays 0 to 120 degree telescopes are there. Now you can see that in case of 0 degree it is like the flat, but your 30 degree lens basically creating a 30 degree angulation with the axis of the telescope, right? And nowadays it is also available like 120 degree, and today's telescope machines, they are able to you can able to control this telescope angulation in a single telescope only, because previously there was multiple telescope, like 0 degree telescope is the other one, there is a 30 degree telescope, 45 degree telescopes are the other. Now your 1.5 millimeter to 15 millimeter telescopes are available. Like you can have a 15 millimeter a radius of the telescope, like a big one. Also you can get a 5 mm telescope, 10 mm telescope as well.
A laparoscopic telescope is a thin, lighted instrument with a high-resolution camera, inserted through small incisions to allow surgeons to view internal organs clearly during minimally invasive surgeries safely and efficiently.